Afternoon. My name is Dr. Chudi, founder of Inspirations Global Health Solutions. Thank you so much. I hope you're having a wonderful Friday. Every Friday is an opportunity to count down to looking after yourself, getting some break, catching up with family, catching up with friends, going for social functions. So Fridays, always a very good day. But every other day above ground is a great day. And today is a great day in our clinic. Today is a great day in our organization. Remember, every Friday by this time, we normally run a special clinic called 40s Fridays. 40s Friday is a very important clinic for women who are about the age 40. Now, every other woman in the organization is also welcome to participate, but we focus more on women who are hovering around age 40. Now, you're going to get to 40 at some point. So whether you're 40 now, you're 42, you're 32, matter of fact, once you hit 35, you are also qualified to be in age 40 bracket. So this afternoon, we're going to take a critical look at labor and delivery. So you've been pregnant all this while and you're in your third trimesters. Remember that pregnancy is divided into three different, positions, three different trimesters. Now, what we're going to discuss today is to focus on the important 6Ps. So there are important components of labor you have to be conversant with, especially as a woman in her 40s. So that's what we're going to discuss today. So when you come in, let's know who you are. So introduce yourself to the admin, know your location, then as soon as possible, I'm going to start the clinic. The idea is to give my presentation, then I'll use the second half of the presentation to answer your questions. So we're going to look at labor and delivery. What are those basic things you should know about labor? Remember, we have a special event coming up on the 26th. We will go there with gender selection. We understand so many of our members are seeking information on gender selection. So we're going to provide you with everything you need. But this afternoon, we're talking about labor and delivery, and it's our special 40s Fridays clinic. And I'm actually going to start. So when you come in, make sure admin is, currently, helping you out if you have any need, okay? Now, labor is a natural process. There are important dates and numbers you have to be conversant with in your pregnancy. The first one is what we call GA, gestational age. Gestational age is the age of your baby as at that time. What we normally use in calculating gestational age is your last menstrual period. So if you notice, when you go for your booking is the first appointment you will have with your ANC doctor. We normally ask you about what? Last menstrual period. When we get your last menstrual period, there are important dates we have to remember. The most meaningful one for you in that particular clinic is what? The age of your baby. So if you notice, GA is reported in weeks. So we don't report pregnancy progress in months. We report it in what? Weeks. Now, an average pregnancy that is going okay is expected to get to 37 weeks. So when a baby gets to 37 weeks, that baby is classified as what? 10. Any other baby that didn't get to 37 weeks and is delivered, that baby is called what? Preterm baby or preterm delivery. Now, an average pregnancy is supposed to last for 42 weeks. Once you have reached 42 weeks, we want to bring that baby out. Any woman that gets to 42 weeks, at the 43rd week, it's called post-date. So all babies are expected to be ready by 42 weeks. Once your baby gets to 42 weeks, there is no other gain inside your womb. We have to deliver that baby. Now, labor is the very last phase that will herald the end of pregnancy. So during labor, your body will begin to change. There will be so many changes. There will be contractions. There will be hormones that will be produced in your body, which will aid your baby to start going down. By the time your baby is going down, your body will start changing and give way for your baby to be delivered. Labor is divided in different phases. I'm not going to bother you about the different stages of labor. It's way advanced for this particular clinic. But remember, you are going to go into labor naturally. Labor is a natural process. So labor is the starting phase of the end of your pregnancy. Pregnancy is considered completely ended by the time we deliver the placenta. So the placenta is the very last thing that will tell us that pregnancy is over. Now, when your body begins to change, there is another important date we have to remember, EDD, expected date of delivery. Expected date of delivery is actually the date you are expected to have your baby. When you are ready, when your baby is ready, your body will begin to change. Those cascade of changes are called labor. So labor simply means the process you and your baby will go through before childbirth. Now, what I'm going to focus on this afternoon is the 6 components of labor, the 6 important determining factors in labor in a woman. Now, expectedly, if this is your first pregnancy, you are likely going to have a longer labor. If you have had a baby before, you are likely going to have a shorter labor. But this is not constant. We might still find women that can have what we call precipitate labor or extended labor, even when you've had a baby in the past. But generally, women that have had their babies before, when they go into labor for delivery, it's normally shorter compared to the first pregnancy. Now, the very first thing you have to keep in mind in regards to labor is what? The passage. So passage means the pelvic region, the pelvic area. Now, when you are going for your ANC, there is a particular test we call pelvimetry. The body of a woman is shaped by God to aid in delivery. If you pay attention, your body and the body of your partner, they are not the same. Women have a shapy hips. Those shapy fats in your body is meant to aid in delivery of your baby. So the first factor that will aid labor is passage. How adequate is your pelvis? How is that your waist? Do you have enough cushioning effect? Do you have a particular pelvic we call the gynecoid pelvic? That's the general pelvic that women are supposed to have. So I want you to compare yourself. When you go home today, strip yourself of all article of clothing. Look at your male partner properly. Then look at your own body. You will see differences. God took time to create women for a special role of having your baby. Now, there are so many women that might have problems in regards to their pelvis. So if you don't have adequate fats, if you don't have adequate hips, let me use, layman terminology, you might have a problem in delivering your baby. If there are any abnormality in the passage, in the vagina, in the cervix, in the womb, it can affect how soon, how easy, how painful, how delayed your labor is going to go. So adequacy of your pelvis, adequacy of your waist, adequacy of all those packages you will use to deliver your baby is the number 1 P. So we are talking about the 6 important P's. The first one is what? The passage. So your vagina, your cervix, your womb, your waist, is everything good? Do you have adequate pelvis? When you have this, then the likelihood you're going to have a good labor is high. Number 2, the passenger. The passenger obviously is your baby. Now, depending on how healthy your baby is, depending on how big your baby is, depending on if your baby had any problems, any infection, any abnormality, so long as that baby is properly developing okay, and there is no problem. The second P is what? The passenger. Unfortunately or fortunately, some babies might be so big. So babies that are big are called microsomic babies. So there are some women that their babies will be very big. Now, when your baby is big, it's possible we might give you episiotomy. So episiotomy is a surgical cut we normally give women to give us more room in the vagina during delivery. The reason why we normally give women that cut is to make sure they have tear. Some women, unfortunately, when we don't give those tear, when the baby is coming, the baby can damage your vagina, the baby can cause a tear. Now, this is the danger. When we don't give you episiotomy surgically, There are important planes we can give episiotomy, then we can suture it back, and they can heal properly. When we don't give you episiotomy because your baby is big, you can have tear. You can have what we call delivery tear. So the vagina can be torn and connect to the anal region. So you can have a connection between the vagina and the anus. You don't want to see that. Very, very messy situation to see. So you see that thick membrane that separates the vagina and the anus. During delivery, we are very, very careful. So if you've had your first baby, the possibility we give you episiotomy is there. When we are cutting you to help your baby to be delivered okay. Most women that are having their baby for the first time might likely be subjected to episiotomy. Okay? Now, that's the second P, right? We've talked about the passage. Now, we've talked about the passenger. The other one is what? The position. The position of your baby is very important. Ordinarily, most babies will position properly. Most babies will present with their head down. It's called cephalic. Some other babies might decide not to come with head. They can come with breech. They can come with their side. They can come with transverse lie. So the position of your baby and the position of your body and the position of your womb is also important. So positioning is the other P. The other P is P for power. So remember passage, passenger, position, and power. Power means, is your body ready? It's your contractions frequently. Is your contractions ready? What actually leads to labor is release of some hormones that will tell the body, you know what? We are done cooking this baby. We want to bring this baby out. So the power of that contraction is very important. If you pay attention to your body, you will notice that you might likely start having contractions every 5 minutes, every 2 minutes, every 1 minute. The closer the frequency of your contraction, the more likelihood that contraction is going to go okay. So when you go into contraction, your baby will start from the top place where your baby is placed and start descending. So the more your baby is contracting, the more the head will be pressing on your pelvis and opening your cervix, and your baby will be fully delivered. Now, women might have a need to have what we call augmented labor. So if you don't have enough power, if you don't have enough contraction, we might support your contraction. We might give you some injections that will help to expel the baby. So this is important. Now, remember, we've talked about the passenger, we've talked about the passage, we've talked about the power, we've talked about position. The other thing is your perception and your psyche. You see, previously, women that have had babies will tell you so many things about delivery. They will put fear in you. You'll be so afraid. You will think that if you're going to have your baby, it will be a painful experience. But when you remember the joy you're gonna have, your perception, your psyche, how you see labor, when you attended your ANC classes, they can put you in a better mode. So you will know that what you're gonna go through might be painful, but the end product is something very, very comforting. So your perception of labor, your perception of childbirth can also lead to problems in your labor. So if you are already ready to see your baby, if you are so excited to see your baby girl, to see your baby boy, to see your twins, to see your triplets, you won't even bother about the pain. The pain a mother is having when she's having her baby, the pain of giving her episiotomy cannot match the joy of hearing the cry of her baby. Women go through a lot of pain as women. So the pain of labor is one of those pains you're going to have, and you have your baby. So the perception is very, very important. So passage, passenger, power, vision, and perception. The other thing is parity. Parity means how many pregnancies have you had in the past? How many labor have you been in the past? How many babies did you actually succeed in having? So the more babies you've had in the past, the better and the faster your labor can be, like I ordinarily explained to you guys. So the last P is what? Parity. Parity means how many of previous deliveries, how many of previous babies did you have? So if you're a veteran, if it's not your first pregnancy, then likelihood that your labor is going to be expedited is very high. So these are the components, important 6P in labor you have to be conversant with. Passage, passenger, position, power, perception, and parity. Let me repeat again. Passage, how adequate is your pelvis? Are you woman enough? Is your pelvic region woman enough? Is your waistline good enough to carry your baby? Passage, passenger, how healthy is your baby? How big is your baby? How small is your baby? Is your baby medium size? Very important. Positioning of your baby. Is your baby coming with head? Is your baby coming with buttock? Is your baby coming with side? That's also gonna help us to know how soon or how delayed labor is gonna be. Power. How powerful is your contractions? Very important. Perception. What have you heard about labor? How fearful are you? How ready are you to see your baby? Then the last one is parity. How many babies have you had in the past? How many labors have you been in the past? These are important 6 P's that will help you to understand labor. And when you understand labor better, you will be in a better position to have your baby. Now, once we have delivered your baby, it's not over yet. The next thing is to deliver the placenta. Once we have delivered the placenta, pregnancy has ended. The overall aim of SGHS is not just to help you to become pregnant. We want to help you to become pregnant. Then we also want to help you to make sure you reach 37 weeks at least and reach your EDD. Once you have delivered your placenta, our contract has ended with you. You now have your baby, you have your partner, you have yourself, so the family will start bonding. The overall aim of our group is to help you to become pregnant, is to help you to maintain your pregnancy, is to help you to go through your ANC, and so it's to help you when you go through labor, when you deliver your baby. Once you have delivered your baby, we have ended our project. So if you are currently pregnant, it's important you know about labor. Very, very important. The classes they teach you when you go for your ANC, very important. Now, as a special gift for all the pregnant women attending this clinic today, I'm going to make available my transcript. I'm going to share the different definition of the 6 P's so that you will understand it better. It's a well-written article. So be on the lookout for it after my presentation, okay? Now I'm going to open the clinic and I'm going to give you an opportunity to ask your questions. Okay, so it's time for questions. Focus on Dr. Ndichie, focus on my admin, focus on Ebenezer, focus on Chinyere, and focus on Evelyn. We are going to help you right now to get feedback. So please start asking your question. The clinic is open now. Okay, it's time for questions. Remember, if you are pregnant in this group, I want you to be careful. One of the best things you can do for your baby is to have a doctor attached to you. So we have a clinic, we have a lounge where all pregnant women converge. So if you are pregnant, I will personally advise you, whether it's first trimester, second trimester, third trimester, or even if it's late, it's better to have a doctor attached to you. So make sure you join our ANC lounge. It's in Telegram. Okay, guys, let's talk. Ask your questions, please. It's time for questions. Please go ahead and ask your questions. I'll provide you feedback. We've also released the PDF of our last masterclass on ovulation and pregnancy. So if you need a copy, follow admin. If you haven't registered for the gender selection super masterclass, the classes are being filled up as we talk. So please go and secure your position, okay? All right, let's see what we have. Good morning, Doc. It's actually afternoon in my zone. It's your second pregnancy going to be easy if your first pregnancy was through CS. Each pregnancy is unique. Each baby is unique. Each experience you will have in your pregnancy is unique. Your previous pregnancy cannot 100% mirror your second pregnancy. Now, this is what you need to know as a fact. If you've had a CS in the past, the possibility that all your subsequent babies will be CS is almost 90%. But there are some women that can have vaginal delivery when they've had CS. The reason is because if we were able to mitigate the reason why you had the first CS, and we find that everything is favorable, you can have vaginal delivery. But this is a decision your doctor will make. So no two pregnancies can be the same. So if you are currently pregnant, the overall aim of all pregnant women is not to start worrying whether you're going to have vaginal delivery or CS delivery. The overall thing that should be bothering you is the health of your baby and your health. So if we tell you you're going to have CS, it's okay. If we tell you you're going to have vaginal delivery, it's okay. If we tell you we're going to cut you, we're going to do instrumentation, whatever we're going to do, relax. You're going to be fine. So I don't want any member of our group freaking out. You're not sleeping because they told you you're going to have CS. And babies can change their mind. Your baby might be doing fine. Shortly before 37 weeks, your baby can become breech. The position your baby will assume at 36 weeks is likely the last position your baby will be by delivery. So if your baby is running all over the place at 20 weeks, we are not bothered. But once your baby assumes a particular position at 36 weeks, 37 weeks, that's the likely position your baby is going to be in. Now, in some facilities, we can flip the baby. We can use what we call external cephalic version to turn babies that are breech into cephalic. Now, it's not applicable in all places. You need to be careful, okay? So if you're going to deliver your baby through CS, that's okay. There's no big deal about it. All right. Okay. Good evening, doc. Is it normal for hairs in your vagina to turn white and start itching? It's not unusual when you are aging. If you pay attention to your body, the pubic hairs in your body, not just the vagina. So the pubic hairs in your armpit, in your vagina, in your hair, and every other place can change. They are completely okay. What's not okay is the itching. So if you're having itching in your vagina, it can be a couple of things. It can be allergy, it can be infection, it can be inflammation. But the hairs completely okay. You don't need to worry about it. Okay, let's continue, guys. All right. A woman becoming pregnant again after 8 to 9 years, what will her experience be like? NB, she has had children in the past. Each pregnancy is unique. If you've had a baby 8, 9 years ago, if you are currently pregnant, first of all, you will be classified as what? Advanced in maternal age. Once you are above 35, we are going to treat you as high risk. Now, beside your age, your medical histories and a couple of things about the past can help us to know how eventful or uneventful your delivery and your childbirth is going to be. Okay? So 8 to 9 years is a very long time not to have had a baby. So many things might have changed in your body. You might have acquired so many medical conditions. You might be diabetic, you might be hypertensive, you might have this, you might have added a lot of body weight. So a couple of things. So the most important thing for you is to register for your ANC on time. When you go for your ANC, we are going to have what we call booking. We check your height, we check your body weight, we check your blood pressure, we check your pulse, we get all the blood works done, we make sure you're doing fine, we give you your anti-malaria prophylaxis, we give you your other ANC drugs, then you start coming to the clinic frequently. Women that are 35 years and above, we see them more frequently compared to women that are younger. The reason is because age is very important. Once you get to 35, we keep a closer eye on you. So all women in their age 35 are classified as what? Advanced in maternal age because they carry risk factors. Okay, so let's continue. Okay, thank you, Dr. Ndiche. All right. Is it compulsory to remove womb with fibroid? No, my sister, let me explain what you need to know. Now, the management of your fibroid is dependent on a couple of things. Number one, the size. How big is that fibroid? If your fibroid is bigger than 6 cm, the possibility is going to give you trouble is high. Number two, position. Where in the womb is that fibroid? If unfortunately your fibroid is located inside the womb, two types, intramural and submucosal, and they are big and they are causing you symptoms, then you will be a candidate for myomectomy. Myomectomy is the surgical removal of your fibroid. Now, some women might be delaying in regards to removing the fibroid, and the fibroid will keep getting big. Let me give you an example. They noticed you had fibroid at 4 cm. They advised you to remove it because of fear, because of so many things. You didn't remove it, and you want to be a mother, right? Which is not good, because when your fibroid is inside your womb and you're not removing it, it's the same place that your baby will develop. And we don't want anything that will disturb your baby. Now, some women might be so unfortunate that the fibroid can actually damage your womb to the extent that we can't even remove the fibroid without removing the whole womb. So there are some women that will need what we call hysterectomy. Hysterectomy is removing your womb. And my sister, to me carefully, when we remove a womb, you can no longer have a baby naturally. You can still have a baby through surrogacy, but you can only have a baby by yourself when your womb is there. So if you have fibroid today, stop running up and down. Stop running away from your fibroid, or stop having a personal relationship with your fibroid. Let go of your fibroid. Now, it's not all women that have fibroid that will need surgery. Some fibroids, you need to just leave them alone. But if your fibroid is symptomatic, so symptomatic means it's changing your life, heavy bleeding, painful bleeding, bleeding in clot, painful urination, painful sex, bloating, you just don't know yourself. Anybody that sees you will think you're delivering next month, but you don't have a baby inside of you. It's just fibroid. So if you happen to have this type of fibroid, the earlier we remove it, the better. But if your fibroid is just there doing its own thing, not disturbing you, then we're going to leave the fibroid alone. Thankfully, as you're getting older, your fibroid will start shrinking. Okay? So the decision of surgery for fibroid is dependent on what? The size, the location, and the symptoms. Okay, let's continue, guys. Please, nobody should provide clinical answers to our members. Admin, stand by. Any member that provides clinical answer to anybody in this group, if you're not Dr. Ndiche, if you're not me, you are looking for trouble. We love our members so much that we don't want to deceive them. Your duty is to attend and learn. So please do not give any feedback to any of our members. You are going to break the rule and we're going to expel you immediately, okay? So when you ask your questions, relax, we'll give you feedback, okay? All right. Can fibroid be removed together with the baby through CS? It's not the best of combination. Some people did that, okay, in some facilities where they have a lot of expertise. Let me tell you why it's not advisable. Fibroid surgery alone is a complicated surgery. It's a major surgery. We will have problem with bleeding. Now, if you are going for CS and at the same time you're going for fibroid surgery, there are so many complications that can happen. You can actually code on the table. You can die on the table. So it's not good to combine CS and removing fibroid. Not good at all. We don't advise that. Okay? So we don't advise that. All right. Let's see. Please keep asking your questions. Okay? Keep asking your questions, please. All right, let's see. Because it's your first pregnancy and you are above 40, your doctor says labor must be difficult. There is no must. There is not always in pregnancy. But if you are 40, the likelihood you're going to have extended labor because it's your first pregnancy is there. But you can still have your baby through vagina. And your doctor can also decide to give you CS. The aim of any good doctor is to have the baby alive and to have the mother alive. So if your doctor decides to go in for elective CS, please don't query your doctor. Okay? There is no always and there is no never in medical practice. All right, guys, ask your questions, please. Okay? Does sleeping position have any effect on babies in the womb? The recommended position in pregnancy is on the left side. So make conscious effort to sleep on the left side. Occasionally, you can flip to the right side, but intentionally maintain the left side. When you sleep on the left side, you are giving you and your baby a good chance to have good blood circulation and good progress of your pregnancy. There are positions you do not ever assume in pregnancy. Don't lie on your back and definitely don't lie on your belly, okay? All right, let's see. Okay, can ovarian cyst in the ovary prevent someone from getting pregnant? So majority of the cysts you will have in your ovaries are what we call functional cysts. They will not affect your pregnancy. However, there are fewer cysts that can affect the production of, the function of your ovaries, and especially in regards to ovulation. So if you have what we call polycystic ovarian syndrome or a couple of other cysts, which I'm not going to bother you because of the, academic purposes, they might affect your ability to become pregnant. The majority of cysts will not. So let your doctor decide, okay? Let's see. Okay, guys, please keep asking your questions. Keep asking your questions, please. Remember, it's our 40s Fridays. and we're just talking about labor. Very important topic for all women, especially if you're currently pregnant. Okay, so I'm searching for questions. I have about 2 more minutes, and Dr. Ndiche is helping me. All right, let's go, guys. Ask your questions. If you haven't registered for the upcoming gender selection masterclass, you are gonna miss a lot. You are gonna miss a lot. I want you to learn. So go and register, okay? Okay. I've answered that. I've answered that. Dr. Ndiche is also answering. So guys, keep asking your questions, please. Okay. Does age affect labor? Yes. Age is a critical factor. So if you are older, the likelihood that all the P's are mentioned might be affected. So the passage might be affected. Your baby might be big. You might have less power. You might have poor perception. You might have had so many babies in the past, or you might not have had baby in the past. The power might not be there. The position might not be there. So age is a critical factor in labor. So age can affect labor, and labor can also affect age. All right. Okay, guys, ask your question. I think I'm actually done. Doc, is drinking too much water bad in third trimester? Now, everything has limits, right? We want you to be well hydrated, but we don't want you to have what we call water intoxication. So I don't know what you mean by too much. The most important thing is to stay hydrated. Water is a good thing. Okay, so long as you're drinking water enough, it's okay by us. So there is no problem. Okay, but remember that the more water you drink, which we all need to do, the more you're going to go to the restroom, which is okay. And by default, you're going to be going to the restroom frequently. Why? Because the pregnant womb is pressing on your bladder. So anytime you have any little urine collected in your bladder, you want to go to the restroom. Okay. Okay. This is a very important question that our member is asking. And I'm surprised that nobody asked about this. What are the particular signs to show that labor has set in? Pain is there. Painful drawing contraction in your groin. So like pain, it comes every 2 minutes. It comes every 5 minutes. And it is increasing intensity. And it's, coming with so much, power. And it feels like your baby, you can feel it in your body. So pain is there. Okay? Now, some women will also have what we call show. And also some women will have their water, coming out. And some women will bleed. Now, these are all telltale signs that labor is settling, okay? So these are specific ones you should be on the lookout for. But there are a couple of other things that, will herald the coming of your baby. So when your baby is good, that contraction will be forceful. It will be coming within a particular limit. You will notice it yourself. You will be in lower back pain. Your whole groin area, definitely, you know that something is going to happen, okay? So they are all built up to labor. All right. Okay, guys, my time is up. Thank you for coming. Please be careful what you rub in pregnancy. Be very, very careful. Okay? You can take your paracetamol if you're uncomfortable, or run it by your doctor and see what your doctor will tell you. These are pain that will bring something good. They will come and go. Okay? You can't stop the pain of labor. They are there. They will play their role. You have your baby. Everybody will be happy. Okay. All right, guys. I think we're done for the day. Thank you so much, Dr. Ndiche. And I'll see you guys tomorrow. Okay. Okay, we've actually attended to all the questions. So, Doc, thank you so much. Remember to register for the Gender Selection Super Masterclass. Remember to grab a copy of the Ovulation and Pregnancy Masterclass. Remember to subscribe. If you need to talk to me, it's possible. You can talk to me for 1 week. You can talk to me for 1 month. You can talk to me for 3 months, 6 months. Then if you're pregnant and if you want to be a mother in 2022, these are opportunities that can give you access to me. Now, when you're coming for 1 week or 1 month, you will have an opportunity to chat and interact. But if you're in 3 months and up, you and your partner can have an opportunity. We can talk once in a month. We can figure out what's going on. Now, the advantages of signing with us. When you sign with me, I'm going to check you. I'm going to make sure you're doing good. I'm going to make sure we actually try to figure out what's going on. Then I'm going to refer you. I'm going to refer you to a fertility specialist on ground who is going to actually take good care of you. Then we are going to co-manage you. So once you come in, there are so many good incentives. So decide today what you're going to do. Remember, today it's the best day in your life to take your decision because this is September. September is the beginning of the period of countdown. So decide you're going to be a mother, then do something about it. Now, if every other thing fails, if there is no other takeaway from our clinic, remember our triple P. We are a group that pray a lot. We pray to God. We love God. God is the person that started all this. Now, when we are done with our prayers, we make love a lot. We are the love-making group, 48 hourly. Keep on making love until you become. Now, we practice. Practicing means whatever I'm teaching you guys today, you follow through. Then you also have your fertility specialist attached to you. Okay, so thank you for coming. I appreciate you guys. I'll see you guys tomorrow during my wardrobe. Bye-bye for now.